good afternoon. I am Gonat Reyes and I will be your student nurse for today. Before we start, can you please state your name and your birthday?
Lisa Manoban, March 27, 1997.
Okay, thank you. So please can I verify your identity through your wristband? Okay, thank you ma'am. Okay ma'am, before we proceed, let me explain the procedure we will be doing today, which is assessing the female genitalia, anus, and rectum. Wherein this procedure is very important po for us to identify various risk factors that may be associated to some underlying conditions that might be connected to your reproductive system, such as cervical cancer. But doing this assessment doesn't mean that you have cancer. So do not worry because we only do this assessment so that we can identify those risk factors and do something about it. And also it will contribute to making valid clinical judgment of your attending physician. So is that okay, ma'am? Do you have any questions regarding this assessment?
None.
Okay, none. That's good. Okay, so before we start, let me also ask you about your cultural awareness and sensitivity. Do you have anything you would like me to avoid doing during this procedure that is regarding to your culture?
Wala po.
Oh, none. Okay, that's good. Also, ma'am, let me provide you privacy by closing the curtain, the window, and also the door. Will that be okay with you, ma'am, so that you will be more comfortable?
Okay.
Okay. Now we're going to proceed with infection control. And for infection control, prior to entering the room, I already perform hand washing because it's very important to do hand washing in 5 moments, such as before touching patient, before a procedure, after touching patient surroundings, and after a procedure or body fluids exposure risk. Also, under the infection control, we also must do the wearing of proper personal protective equipment such as donning fresh gown, wearing mask, wearing protective glasses, and also wearing gloves. So now we're going to proceed on gathering all the required equipment needed for this assessment, such as a stool, light, water-soluble lubricant, large swabs for vaginal examination, vaginal speculum, a specimen container, and also gloves. Now we're going to proceed with asking the patient's history regarding the current health concern. And with that, I'm going to ask the patient some questions. Okay? Okay, ma'am. Now po, magpo-proceed po tayo with asking you all about your health history that will help po with this assessment. Will that be okay, ma'am?
Sure po.
Okay. So, with this interview po, I would like to just give you a heads up that some questions might feel like very private to you, very personal, but sure, let me assure you po that all of the data I will be getting here will remain confidential and it will be only between us and your attending physician. And also, it is necessary to be answered because it will be a really great help in this assessment po so that we can make a valid clinical judgment and know what is really going on with your current health concern. Will that be okay, ma'am?
Yes.
Okay, that's good po. So, shall we start now? Okay. Okay, let me just get my pen. Okay, ma'am. So, the first question I have, can you tell me when is your last period?
Last June 3.
Okay. Is it regular or sometimes there are some delays?
It's regular.
And how long does it usually last?
Usually 3 to 5 days.
Okay. And can you describe to me how was the blood flow? Is it heavy or light?
Heavy.
Okay. Any experience of blood clotting?
No.
None. Okay. So, what are the other symptoms you experience before and after your period? Does it have some cramps, bloating, moodiness, and breast tenderness?
Commonly cramps and moodiness.
Okay. And can you tell me How old are you when you first got your period?
13 years old.
Okay. Have your periods stopped like for a month or weeks?
No.
Oh, never. Okay. How about any experience of vaginal discharge that is unusual, like it has some odor or some color, unusual colors?
None.
None. Okay. Have you experiencing pain in your genital area?
No.
Okay. How about, are you drinking some laxatives or medications regarding with your stomach?
I don't.
None. Okay. So, for your lifestyle, do you smoke?
No.
And can you tell me how many sexual partners do you have?
Just one.
Okay. So, in your family history, is there anyone who experienced genital or reproductive trauma or cancer?
None.
None. Okay. Okay, do you have any fertility problem that has been diagnosed before?
No.
Oh, none. Okay, so how about sexual activity pattern or problem?
None.
None. Okay. In your urine, have you experienced having it in a unusual, different color?
No.
None. Okay. And lastly, are you experiencing any difficulty with urinating?
I don't.
No. Okay. So that is all, ma'am. Thank you for your cooperation. Okay, now we're going to proceed, but first ensure that we assisted the client in changing her clothes to a hospital gown and then ask her to remove her underwear and assist her in a dorsal recumbent or lithotomy position so that we have a better view of what we are going to assess. And once the client is comfortable and settled, we can now proceed to the procedure. And the first thing we're going to do is to inspect the mons pubis of the patient. With the mons pubis of the patient, it is located here. And now we're going to assess of the distribution of the hair. Okay, for the distribution of the hair of the patient, what I can see here, it is in a inverted triangular pattern, which is a normal finding. And also, from what I can observe, there is no signs of infestations, which are also a normal finding. Okay, now we're going to proceed with inspecting and palpating for inguinal lymph nodes of the patient. So, for this, it is located here at the singit na tinatawag natin. And for the palpation, I'm going to use the pads of my 3 fingers and put medium pressure. Okay, now ma'am, I'm going to proceed with palpation. So, I will be touching your side area. Okay, is that okay? Okay. Okay, so as I palpated the patient, from what I can feel, I only felt some muscles, fats, and bones, which are all normal things to feel. And also, I can say they are normal because they're non-tender. And I did not felt any hard lumps as I palpated the patient, which indicates that there are no inflammation of the inguinal lymph nodes. And for the inspection as well, I can see that there are no presence of redness or swelling, so everything is all good. Now we're going to proceed to inspection of the labia majora and the perineum. Okay, so for the labia majora, it is located here at the outside. And also, from what I can see here, is that the labia majora of the patient is very symmetrical, which is a normal thing. And also, it is free from lesions and swelling, so that is good. And as for the perineal or the perineum area of the patient, it must be here at the space between the vaginal opening and the anus, so it should be here, down here. And as what I can see with the perineum area of the patient, it is smooth. There are no presence of scars because it could be scarred if the patient has given birth vaginally, but my client have not, so it is very smooth. And also, the client might feel some pain in her perineum area if she also experiences UTI or urinary tract infection. Now we're going to proceed on inspecting the labia minora, the clitoris, the urethral meatus, and also the vaginal opening. And for that, technically, we're going to use our glove hand, and then we're going to separate the labia majora so that we have a better view of what we are going to inspect. So first is the labia minora, which is technically inside. That's why we separated the labia majora. So it's here, and from what I can see, it is symmetric as well. It is in a dark pink and also moist. And now for the clitoris, which is above, so it's here. It is actually an erectile tissue that is sensitive to touch. And then below it is the urethral meatus and also the vaginal opening just below it. And all of these areas must be free from lesion, swelling, inflammation, and unusual discharge. And for my client, she is negative to all of those, so that is good and normal. Okay, now we're going to proceed to another set of palpation, wherein we're going to palpate the Bartholin glands and the urethra. So for the Bartholin glands, it is located here below, here, and also the urethra is here. Okay, so for the Bartholin glands, we're going to palpate it using our index finger and our thumb. So we're going to use these to do some gentle pinching motion, wherein the index finger is located near the vaginal opening and the thumb is here at the labia majora, and here we're going to do our pinching motion. So it must be gentle and soft. Okay. So for the normal findings as we palpate the Bartholin glands, it is usually non-tender and soft. And also the presence of hair is all normal. So for the urethra, we're going to first assess it and see if we suspect any inflammation. Okay? So if we do suspect that the urethra is experiencing some inflammation, we need to confirm it. Wherein we're going to use our glove hand, put some lubricant to 2 fingers or even 1, and that's fingers, we're going to insert it inside and meet the urethra there so that we can palpate it and confirm the inflammation that we suspected. So we can insert it up and out or up and down motion so that we could confirm the suspected inflammation. Okay, now we're going to proceed to the inspection of the size of vaginal opening and the angle of vagina. Okay, so the vaginal opening is located here, and then we're going to use our index finger to note for the size. Okay, so we must feel whether it is thinning or feels dry. As for the normal size of the vaginal opening, it actually varies, depends on age, the sexual history, or if the client has already experienced given birth vaginally. And as for the angle of the vagina, it is usually at 45 degrees angle. Now we're going to proceed on assessing the cervix. And for this procedure, we're going to need a speculum so that we could have a better view of what we are going to inspect and also to visualize the cervix. And once we already put the speculum and we have the view of what we are going to inspect, we are now ready to inspect its overall appearance. And as for the cervix, we can observe the color, wherein the color is usually pinkish. And for the women or older women, they are usually pale, and for pregnant women, they are usually blue in color. So for the appearance, it's usually smooth and even. Okay, that are all normal findings. And also, if the physician orders to get a specimen so that we could test for some STIs, we can obtain it here. Just use some vaginal swab and get some specimen. And as for the cervical secretion, they are usually clear in color and odorless, and truly depends on the woman's menstrual cycle. Okay, after that, we're going to now inspect the vagina. So overall, the vagina appears smooth, pink, and moist, and also free of lesions and swelling. And also, there are no presence of discharge that is colored and malodorous. So everything about the vagina are normal findings. Now we're going to proceed on the palpation of the vagina wall, cervix, uterus, and ovaries. And for that, we're going to need our glove fingers lubricated. And we're going to use mainly here our index finger and the middle finger. Wherein in the palpation, we need to insert these fingers inside the vaginal opening, okay, and wait for the outer to relax. So we need to wait for it to relax and start the palpation inside. And for the normal findings, we need to find it smooth, firm, and somewhat tender. We're now going to proceed to the assessment of the anus and the rectum. And for that, we're going to inspect first the perianal area. And for the perianal area, we must change the gloves after inspecting the vagina because it is another area and we don't want the risk of the transfer of any microorganisms. So we need to change our gloves and lubricate again. And now the first thing we're going to do is to separate the buttocks. So we need to separate the buttocks so we have a better view of the perianal area. Okay, so after spreading the buttocks, we need to inspect what we are going to see here. Okay, it must be free of any ulcers, lumps, redness, swelling, and also the perianal area must be darkly pigmented than all the skin around, and also it might be or it should be tightly closed and free of any hair. If that is the case, then everything is normal with the client's findings. Now we're going to proceed with palpation. The first thing we're going to palpate is the anus of the patient. And for this, we first need to lubricate the pad of our finger, particularly the index finger, since this is what we are going to use. So we need to, after lubricating it, we need to insert it slightly at the opening of the anus and apply slight pressure. But if the client experiences extreme pain during this procedure, then we need to stop and do not push the examination anymore. But if the client can bear it, then we're going to proceed with the palpation. And we need to palpate for the presence of nodules, tenderness, and hardness. And the normal findings should be none. Now we're going to proceed to the last part. And to the last part, we're going to palpate the rectum. And since earlier we already inserted our index finger to the opening of the anus, we're just going to insert it a little further so that we could reach the rectum that we are going to palpate. And once we reach that, we're going to palpate the rectum in a manner that we're going to rotate our finger in a clockwise motion and then counterclockwise. With that, we palpated the rectum and take note for any tenderness, nodules, irregularities, and hardness. And of course, the normal findings should be none. Okay, so that's it for the procedure. And after that, make sure that we assist the client to a normal position again, which could be a sitting position or a supine position, and then assist them in putting on their underwears or normal clothes. And now we're going to ask the patient if she is feeling comfortable or if she's feeling any pain after the procedure. Okay, now ma'am, the procedure is done. How do you feel right after it?
I'm fine.
Okay, so that is good. So if the client is feeling good, we're now going to proceed with documentation. For the documentation, we're just going to take note of every data we've gathered during the procedure and ensure to the client that all of the data will remain confidential between you and the attending physician. And now we're going to proceed with reminding the patient about holistic nursing. Okay, now ma'am, the procedure has come to an end. So as we part ways, I would like to remind you all about the holistic nursing. So the holistic nursing is when we care about you, mind, body, and soul. So may it be any aspect, we care of you, definitely. So just reach out to us if you need anything, if you need or you have some health concerns. So that's it, ma'am. Thank you for your cooperation.